what happens if you're on a GLP-1 medication and not losing weight? This occurs every now and then, and there are a few things that you want to consider. These are remarkably effective medications. They help to control blood sugar and insulin levels within your body and have been really effective at helping a lot of people lose a lot of weight. So if that's not happening, you've kind of got to troubleshoot it a little bit and think through some things. The first that I always consider is it diet? You can, as we say, eat through these medications, usually done with high fat or high sugar foods, particularly with people who tend to eat fast. Try to slow down a little bit when you eat. Focus on protein. Doesn't have to be a fad diet or anything overly restrictive, but focus on protein. Eat relatively good food in modest amounts. Eat, take a break, let the medications do their work as far as making you feel full. So that's the first thing you want to consider. The second is just drug related. Sometimes you may need a higher dose. Often that's a simple solution, is just to up the dose. The other is to change the medication. They're the GLP-1 medications, but there are different ones. There are the so-called GLP-2s, GLP-3, just different variants of this type or class of medications, and some of them are more effective than others and have been shown to be so in clinical studies. So particularly if you've lost weight on one and kind of hit a plateau, or you're on one and you've upped the dose and it's just not working, it may be reasonable to switch to a different medication that might be more effective. The other potential issue here is that you're just not getting the medication. I've had this happen at least twice with some of our patients now, where they were on a pretty strong medication at a pretty high dose and not losing weight, and the pieces didn't all fit. So when we moved them over to our care and shifted them to the same or sometimes even a lower dose of medication with us, they started dropping weight. Most of the time that's probably not an intent by anybody to defraud someone, but these medications have got to come from a good, reputable source. They also have to be handled and stored appropriately so that they don't lose their effectiveness. So if you're having an issue, you're on a GLP-1 and not losing weight, or not losing weight like you think you should be, consider some of those factors and come talk to us at GameDay if we can help you out.